Three conditions that I want you to differentiate perfectly. So we have coronary artery disease. This is what you people call a heart attack or myocardial infarction or angina. You see the one that you get difficulty in breathing and then chest pains, and then there's like a sharp pain that radiates to the back and then towards the left hand, because we call that referred pain. Referred pain basically means, you see, you cannot feel pain in the heart. You people will say, oh, a heartbreak, I feel pain. I was broken the heart and it's so painful. Hey, a heart is a muscle. It doesn't feel that pain that you actually want it to feel. Right? So there is a nerve that supplies the heart. The same nerve supplies the left side of the body, basically the left hand and all that. So it's called referred pain. So when you have a pain in the heart, this pain is radiated to the left hand. When you have a pain in the kidneys, you start feeling lower back, your back pain, lower back pains, because it's referred pain. So that nerve simply sends pain to the left hand and is so characteristic. Very sharp pains in the chest, difficulty in breathing, and then that pain radiates to the left hand all the way to the back. That is what we call angina. And then you go and you're given some medication to actually open up those blood vessels, to actually increase blood flow towards the heart muscle so that the pain disappears. Some of you are given painkillers to fix the symptoms. But that is what we call coronary heart disease. We're going to base our conversation on that because that seems to be the mother of most of these heart conditions. Number two, we have the heart rhythm disorders. Heart rhythm, all right? There's a heartbeat, there's that rhythm, a normal rhythm, lapped up. So there's a normal rhythm, the one that the doctor takes or measures using the stethoscope. You want to know if the rhythms are okay, if there's some murmurings or so. That is what we call heart rhythm disorders. Most of us call them arrhythmias. You see, when I tell you arrhythmias, you're like, doctor, no, arrhythmias basically means abnormal rhythms of the heart. All right? And those rhythms, these are basically nervous transmission, abnormal transmission of electrical signals to the heart muscles. For you to get the heart to pump, it must be stimulated. And there is now these nerves that supply the heart muscles that rely on electrical signals to stimulate the heart muscles. You see that? That's why we take electrolytes. That's why we take water and salt. That's why we take magnesium. That's why we take potassium in foods and all that, to basically balance the electrolytes so that the heart muscles can contract in a very, very stable rhythm. Number three, we have heart valve disease. Heart valve, we have valves in the heart. Valves that actually prevent blood from coming back to the heart, and valves that actually channel blood into the heart and out. So they block the blood coming back so that we don't have the lodging of blood in the heart muscles, all right, or inside the heart. So when the heart pumps, these valves open to allow blood to get out, and then they close to allow to block the backflow of blood into the heart. Those are the valves. Some of these are actually destroyed by medications. Some of them are destroyed by old age, inflammatory foods. As you age and as you consume a lot of inflammatory foods, you're actually causing a lot of problems to these valves. So wear and tear, they start to tear, they start getting inflamed, and now they cannot perform adequately. So we have this blood lodging into the heart, and we also have backflow of blood into the heart, a lot of problems, right? And also, those heart valve diseases are actually caused by most diseases or side effects of medication, like the COVID medication. COVID medication actually caused a lot of problems with these heart rhythms. Drugs like fluoroquinolones, I don't want to use those words most of the times. Okay, those drugs that are in the class of ciprofloxacin. Most of you have used Cipro. When you have a diarrhea, when you have food poisoning or typhoid, Cipro is a very, very common drug. Or even urinary tract infections, Cipro is there. Those drugs that are in that classification, we have norfloxacin, we have ciprofloxacin and others. They can actually cause you problems, right? We have problems with these valves. Another one, these valves can actually be, there are children who are born with defective valves. That's basically congenital, what we call congenital. These big words, don't let them destroy your mind. Just allow yourself to actually understand what is behind this. So when you say congenital, we mean birth defects, all right? And then we have cardiomyopathy. Cardiomyopathy is myo is muscle. Cardio is the heart. So cardiomyopathy. Pathy means destruction. So diseases that involve the muscles of the heart, that's what we call cardiomyopathy. COVID vaccines also came in the side effect of cardiomyopathy. You see that? So drugs can be a cause of these problems, nerve defects, electrolyte imbalance or mineral deficiencies, congenital issues can actually cause the destruction of the valves in the heart, causing you heart problems. And then we have the heart failure. So most people struggle differentiating between a heart failure and a heart attack. I just told you a heart attack is basically there is no oxygen and nutrition towards the heart muscles. There is limited flow of oxygen and nutrition towards heart muscles. They start dying. We end up having a heart attack. It starts with very painful, those projections in the chest and the back and the left hand, and then you end up having a heart attack. So the heart just, pop, you're gone. And this life is actually inspired by one of my clients. I met this client on Tuesday. We had a good conversation, and this client gets on back to his home. And on Friday, this guy has shortness of breath, and boom, rushed to hospital, and we lost that guy. That is a very sad story. Very sad story, and may his soul rest in peace. All right. So heart failure is a different one. Heart failure is basically the heart is unable to meet the needs of the body. So it's unable to pump enough blood that is going to supply the entire body. That's a heart failure. See that? So it is unable. It's not dead. It's not suffering. It has not stopped. It is still pumping, but there is a high demand for oxygen, for nutrition, and for blood into the tissues and organs. But the heart is unable to meet that demand. That need, it doesn't meet. That's now a heart failure. So the heart has actually failed to meet the demands of the body. But heart attack, reduced oxygen and all that, and then the heart muscle starts to die, and we have issues with the heart attack. So I thought you should know that.